Hello and welcome to the 18th European Journal of Cardiovascular Nursing's Journal Club. Today we will be discussing Ming-Fen Tsai's paper, examining symptom trajectories that predict worst outcomes in post-coronary artery grafting or bypass grafting patients, CABG patients. Ming is from the University or Chenggang University of Science and Technology, College of Nursing in Taiwan. I am Chantal Ski. I'm a reader at Queen's University Belfast, and today I will be moderating the session. I'm a psychologist, and I've spent probably the last 20 years researching and working with cardiovascular patients. So I'm very interested in patient symptom trajectories, and I have been looking forward to this discussion today with Ming. So today, Ming will introduce the paper, give a brief introduction, and then after that, we'll have a discussion where I ask Ming some questions. So over to you, Ming.
Hi, everybody. My name is Ming-Fen Tsai. I'm an assistant professor at the College of the Nursing, the College of Nursing in Taiwan. It's a great honor to be joined by Dr. Ski today and present my paper.
That's great, Ming. Perhaps you could give us a brief summary of your paper.
Yes, thank you. CABG is one of the most interventional revascularization procedure used to treat acute coronary syndrome worldwide. There is a wide variability in post-operative symptoms reported by patients, making it difficult to design interventions to improve symptom burden. Identification of symptom trajectories during the 3-month post-op recovery period will improve clinicians' ability to improve symptom burden. So the aims of the study were to identify whether there are distinct trajectories of symptom seen over time in the cohort of patients under the 3 months post-CABG period, and also to determine which clinical characteristics and personal variables are associated with different symptom trajectories post-operatively. So we conduct a prospective trial to collect data regarding patients' clinical characteristics and symptoms at baseline, prior to surgery, and at 1 week, 6 weeks, 3 months following CABG, using cardiac symptom inventory, also known CSS, and a Latin class growth model and multivariate logistic regression were used for our statistic analysis. So a sample of 198 patients undergoing CABG from 6 medical centers in Taiwan participated in this study. Angina, dyspnea, fatigue, depression, sleep problems, and anxiety were the most disturbing symptoms reported among this patient population. Based on the evaluation of observed symptom trajectories were explored for these 6 symptoms. We identified 2 to 3 classes of trajectories for each symptom. Age, longer ICU stay, fewer vessel bypassed, off-pump CABG, history of tobacco use, and history of no regular exercise were associated with worse symptom outcome trends over time. So using this unique trajectory-based research method, we are able to achieve a better understanding of the specific characteristics linking to symptom recovery pattern over time. So hopefully recognizing the risk factors and corresponding potential recovery pattern prior to surgery may allow healthcare providers providers to deliver targeted discharge planning and more individualized care for patients after CABG. So I think this study allows healthcare provider and patients to understand and anticipate the course of CABG recovery based on individual patient characteristics. So.
Yes, I agree. I think it's a very novel study because it's never been done. Or look, patient symptom trajectories have never been looked at in this population before, and it is, as you say in your paper, one of the most common surgical procedures. So it's quite surprising that it hasn't been done before, and it's commendable that you've done it. And is there any other particular reasons? Of course, previously have been identified some of the quite burdensome symptoms, factors such as depression, anxiety, and fatigue. What else was it that made you look at this population, the CABG population?
Thank you. Because cardiovascular disease has been the #2 killer in Taiwan for the past several decades, and CABG surgery is, as I say, most common intervention to treat the disease, the CAD. So it's reasonable to have a better understanding of the recovery pattern over time to in this population. I've been working with the CABG patient for almost 15 years because even though I teach in the university, but I actually try to manage to do this clinical practicum at hospital at least 1 month every year. So I have the privilege to work with them. And over time, I found that unfortunately, a lot of patients expect that their disease condition will be completely cured soon after surgeries. So when they find out that, for example, they are experiencing this persistent depression or fatigue and may last up to 1 year as well, then they feel very upset. So then one thing did another. You will think the recovery process will be longer and more distressed.
Thank you, Ming. That's really interesting. And it's nice to know that it was based on anecdotal evidence from your nursing experience. Another question I have is you used the cardiac symptom survey, but you to look at symptoms and also translated that into Taiwanese using very robust methods, I noticed. What was the reasoning behind dropping the response to physical activity and enjoyment of life in that scale for your population?
Yes. Well, for this instrument, actually, there are like evaluation. In terms of evaluation of the symptoms, we look at severity and frequency of the symptom for that part. And for the response to your daily life, physical activity, oftentimes we feel like they are the score is identical. So we feel like now it's unnecessary to check them both. So for example, in other paper I read, actually, sometimes it shows that if you have this depression, for example, again, probably you score at around like 4 or 5, and you will have a response to their enjoyment of life will be like 7. Actually, the influence is higher to their enjoyment of life, but in our population, it's almost identical. So we kind of just drop the.
Yeah, that's quite interesting and a very psychometrically sound reason to drop that part of the instrument if all the responses in a Taiwanese population were similar. Thank you. You identified some very important symptom trajectories. Would you, if you were to nominate the top 2 or 3 symptoms that you thought contributed most to worse patient outcomes, what do you think those would be?
Thank you. I think fatigue and depression will be the top two because for in this study, actually, we observed that we noticed that there is like 50%, 15% of our population actually they start with the fatigue, like moderate baseline, and only slightly decreasing. So the score is like from 5.2 drop to 4, so very slightly drop. And for depression, actually, they are 12% of our population. The fatigue actually persists from pre-operatively 2-3 months post-op. So for that 12% is actually very significant. The depression never get away. So never get away.
So they seem to persist most of all up to 3 months, because I noticed a number of other symptoms such as pain, they resolve quite quickly. So
yes,
it's good to know that perhaps that's the two that clinicians need to keep an eye on.
Yeah, and like you are especially in psychiatric, so you know that depression often comes with anxiety. And in our study, actually, here says 36% of our population actually they have the moderate baseline anxiety level and only gradually decreasing, not much, less than 1 as well. So I think here mental components really play a part here. So I'm glad that you mentioned about this. Thank you. Yeah.
Oh, thank you very much. And thank you everyone for joining today's webinar and taking the time to listen to Ming and hear about her very interesting paper. And also, don't forget, if you do enjoy watching these things online, the European Journal of Cardiovascular Nursing have a number of other online resources, such as their virtual special issues, which you should have a look at also. Thank you, Ming, and goodbye.
Thank you.